My name is Dr. Chris Stepien with Barefoot Rehab, and we recently had a comment on one of our YouTube videos that got 15 upvotes. How do we get a doctor that will listen to us that have this painful problem? In this case, we're talking about piriformis syndrome. Every time I mention this, they just brush me off. I diagnose myself. So about a couple years ago, we actually wrote an ebook called The 7 Mistakes People Make When Choosing a Pain Doctor. We had a woman in her early 30s come to see us about 6 months to a year ago who had seen 30 neck pain specialists, spent $20,000 before finding us at Barefoot Rehab. So we've identified this as a problem for years, and it's something that really annoys and frustrates people when doctors seem to not give them the attention that they deserve. So the ebook we created was The 7 Mistakes People Make When Choosing a Pain Doctor. The first mistake that people make is that when people choose a doctor, they choose exclusively based on who is in network. When a doctor is in network, what that means is that that doctor signs a contract saying that they're going to do their healthcare based on how the insurance company dictates it. The problem with that is, what is somebody's problem and what is the solution for that problem? Medicare will only pay money to doctors who adjust the way that chiropractors are taught to adjust, popping the spine. We don't ever adjust or pop somebody's spine. So why would we adjust somebody's spine in order to get paid when it's not what allows somebody to have permanent pain relief? So that's just an example where choosing exclusively based on being in network does not allow somebody to achieve the result that they want. Mistake number 2 is choosing a reductionist doctor. So yes, it's true. At Barefoot Rehab, we specialize in removing adhesion better than anyone else does in New Jersey. However, just because we specialize in removing adhesion does not mean that we can fix everybody's pain problems with adhesion removal. We need to be respectful of other people's problems. If somebody is 400 pounds overweight and we say, hey, you've had a year of pain and you just need to come see us, pay us money, and we're gonna get you 100% better, we're lying. That's not true. So often, as somebody is very overweight, we'll say, the first thing you need to do is hire a nutritionist and a personal trainer, and you need to lose weight, or whatever we do is not going to help you. And that's just honest healthcare. Or if someone has an autoimmune condition, psoriatic arthritis or lupus, and their diet is horrible, we'll say you need to go and see a functional medicine doctor because your pain is constant and gets worse when you eat inflammatory foods. So go see the functional medicine doctor, then come back to us. So a big mistake people make is choosing a doctor who specializes in one thing and his only focus is on one thing that is not respectful of other areas of healthcare that allow us to take a more comprehensive picture. Mistake number 3 that people make when choosing a pain doctor is ignoring social proof. So they'll choose doctors that either have no social proof or maybe have some negative reviews. And social proof is something that's been with human beings for tens of hundreds of thousands of years. We do things and go see people based on where they've gotten results. So we're really proud that at Barefoot Rehab, we have well over 100 5-star reviews on Google, Facebook, and videos on YouTube and Facebook as well. And we're super proud of that because any patient who's come through our doors has had pain more than 6 months and seen at least 3 other doctors without permanent pain relief. So we continue to tell people about the results we get because we want our patients to know that they can trust that they're gonna get really honest, good care here. When you ignore social proof, you're laying yourself at the hands of people who could potentially take advantage of you by not getting you the results that you deserve. Mistake number 4 that people make when choosing a pain doctor is not fully understanding how a diagnosis will be made. If someone's going to go see a doctor and all they do is a 5-minute history, where is your pain, and maybe they do an electronic scan of their spine, that's a garbage diagnosis. Our new patient intake forms is 5 pages long. People usually get exhausted and say, that was more than I've ever filled out. And you're like, you're damn right that was more than you've ever filled out, because we need those details. And then when we do the consultation and the exam, we're looking for a lot of details that people aren't used to sharing. And then sometimes people say, why do you need all this information? And then I'll tell them, you've had this chronic problem for more than 6 months. You've already seen 3 doctors with 0% permanent relief. We need these details in order to diagnose you correctly and completely, so that you know if it's worthwhile for you to come see us at this office. So you can ask those questions of a doctor's staff when you call them and say, how will I be diagnosed? Will it be 5 minutes? Will you feel the muscle tissue? Will you take an x-ray and MRI of my joints? Will you take a complete history? Will you measure my ranges of motion? How will you diagnose me? And then you can make a judgment call based on intuitively how it feels to you, whether they're going to diagnose you correctly or not. Generally, the more information and more data that a doctor or a clinic is gathering of you, the better the diagnosis is going to be. And then from there, you can get the proper solution or treatment for that problem or diagnosis that you have. I love mistake number 5. Mistake number 5 is people forget to ask a doctor about their failures. So when I refer people to surgeons for surgery, I always ask the patient to ask their surgeon, what percentage success rate do you have? And anytime a surgeon says I have a 100% success rate, run out the door screaming because that's not realistic. We fail patients all the time. It's true, it's reality. We can't fix everybody who has chronic pain. That's not realistic. Some people are just gonna abuse themselves so much and have so much joint degeneration that there's nothing we can do to fix them. People who have already had cervical fusions on their neck, it's really hard to get results with them because they can barely move their neck at all. We can't tear away the adhesion. So it's really important that doctors are honest with their patients about their failures. And then for patients to hear that honesty, that reality, that truth about how successful that doctor is, and then for that patient to be able to judge whether they want to give their trust over to that doctor. So you can just ask as a potential patient of a doctor or clinic, where do you fail people? How do you fail people? What mistakes do patients or doctors make, or you as a doctor make, that allows these failures to happen? And which of these are controllable, which of these are not? But it just allows a really honest, vulnerable, transparent communication between a clinic, a doctor, and a potential patient that will allow you to get a feel for what type of doctor and staff that you're dealing with. Mistake number 6, does a doctor and or a clinic or pain clinic preach what they teach? Would you go and see a medical doctor for a solution to your diabetes who was overweight? Would you? Would you go and see a pain doctor who is in chronic pain all the time? Would you hire a personal trainer who was overweight all the time, or a dietitian or a nutritionist or a functional medicine doctor? Would you see a psychotherapist who was miserable all the time? It's a really amazing sign to be able to observe what somebody is saying out of their mouth as far as words go and what their actual behaviors are. We can observe this with parents and their children. Parents sometimes will say, do as I say, not as I do. But I would argue that children should do as their parents do, not as they say, because it's more honest and it's an easier way to learn. We can use that same observation we make with parents and their children with doctors. Do they preach what they teach? Do they seem honest? Can you give them your trust? Mistake number 7, the last mistake that people make when choosing a pain doctor, is not judging how the doctor's staff speaks with you. When a doctor's staff is short with you or is rude with you, you can probably expect that that doctor is short or rude with their staff, and or that doctor will be short or rude with you. So something we're very proud of at Barefoot Rehab is we have a culture here, and we try to treat everybody who comes into our circle with love, with kindness, and with respect. And Our staff here is very proud of the fact that they're extremely kind, extremely nurturing, and extremely warm with anybody who might reach out to us. So you can judge the way that we treat each other inside of these walls at Barefoot Rehab, that we're going to treat you similarly, that we're going to be honest with you, that you can let your guard down. It's common almost every day that somebody is crying tears in here, and that's simply because we create a space where we allow people to share and to be open and be honest and to let themselves go. And that emotional catharsis, that letting go, allows people to have really deep healing because they realize that we're on the same side as them. So when you call a pain doctor or a pain clinic, how does the staff speak with you? And then use how the staff speaks with you as a reflection of how your time is going to be with that doctor. Those are the 7 biggest mistakes that people make when choosing a pain doctor. As I've mentioned to you before, we had a patient, Diana, who saw a 30 neck pain specialist, spent $20,000 before finding us at Barefoot Rehab and getting 50% permanent pain relief with her neck. So Peggy King on YouTube, it's hard to find good doctors. It is. If it were easy to find good doctors, there would be a lot less people suffering with their pain issues or their health issues. But if you use these 7 mistakes to learn where you can do better, then it'll allow you to choose the correct pain doctor or the correct health doctor, whatever area of health you're looking for, so that you don't waste your time, you don't waste your energy, you don't waste your money, and you can live life the way you want to without this aspect of your health holding you back in life like a ball and chain that doesn't allow you to go where you want to go in life. So don't make these 7 mistakes. I'm Dr. Chris with Barefoot Rehab. I hope you have a great rest of your day.